once again, thank you so much for tuning in to my YouTube channel. I'm very grateful that we are going to share knowledge because knowledge is strength. Don't forget to subscribe and like the video in case you find it of importance. Today we are going to look at the breast or the mammary gland. Now, by the end of our discussion, we should be able to define a breast. Actually, what is a breast? What is the shape of the breast? What's the difference between the male and the female breasts? What are the anatomical boundaries of the breast? All such questions are going to be answered. So what is the breast? The breast is a modified gland of apocrine type that is rudimentary in males but well developed in females. Actually, the breast is an accessory organ of the female reproductive system. The breast is made up of mainly three components. That is the mammary gland, which is made up of the parenchyma, which secretes the milk. It is also made up of the superficial fascia, which is basically made up of the fat and the fibrous tissue. It is in this superficial fascia that we find our mammary glands. So the mammary glands are embedded within the superficial fascia. Actually, if you look at the breasts of females, they are more well developed. And this explains that they are made up of too much fat. Then you have the overlying skin, and the overlying skin is mainly made up of the nipple. The nipple is made up of smooth muscles, of holes. The nipple is actually found along the mid-clavicular line. Now, when you talk about mid-clavicular line, we are talking about a line that divides the clavicle into two equal parts. Let us see this. So when you divide the clavicle into two equal parts, you will have our mid-clavicular line. And along the mid-clavicular line, that's where we find our nipple. However, horizontally, our nipple is also found in the fourth intercostal space. Our nipple is found in the fourth intercostal space. Then we also have around the nipple, there is a pigmented area. That pigmented area is called the areola. The areola is also made up of sebaceous glands that we call Montgomery glands, which secrete the oil that lubricates the nipple for easy suckling of the baby. Of course, there are some sex differences. If you look at the breast of a female and the breast of a male. So what's the main difference between these two breasts? Realize that both the males and females have breasts. However, the breast is well developed in an adult female, but it is rudimentary in males and also in females before their puberty. And if we look now at the breast, you want to concentrate more on the adult female breast. If you are concentrating on the adult female breast, and basically now at the moment we are concentrating on a nulliparous woman, a woman who has not yet given birth. Now, if you look at their breast, the shape is mainly conical or hemispherical. And if we proceed, if you look at this breast still, the breast, its extent is that the breast is sitting on the superficial fascia of the pectoral region. And it has a small extension around here that we call the axillary tail of the breast. The base of the breast extends from from here, that is superiorly, from the second rib, then inferiorly from the sixth rib. So the breast is found between the second and the sixth ribs. Then medially, the breast is found along the lateral margin of the sternum. And then laterally, the breast is found along the mid-axillary line. Just like the word mid-axillary, it's the line that divides the axilla into two equal parts. So what is the axilla? The axilla, it can be called the armpit. The mid-axillary line can be illustrated as this line. So that is the extent of the breast. However, we say the breast has an axillary tail. We call the axillary tail of Spence. Now, Spence was the scientist. He was called James Spence, a Scottish anatomist who discovered the axillary tail first. Now, they can ask you, what is the axillary tail of Spence? Now, the axillary tail of Spence is a small upward extension from the upper lateral part of the gland. A small upward extension from the upper but lateral part of the gland or the breast, which runs along the lower border of the pectoralis major. And then, if you look at it, it pierces the deep fascia to reach the axilla, where it lies in direct contact with the axillary lymph nodes. If you look at the deep relations of the breast, the breast is mainly sitting. Like if you go deeper and deeper where the brain is found, the breast is found on actually muscles, and these muscles are mainly three. Of course, superiorly, you realize that the breast is sitting on the pectoralis major, and above the pectoralis major, that's where we find the pectoral fascia. So the pectoral fascia covers the pectoralis major, onto which the breast is found. However, along this attachment of the breast, there is a loose areolar tissue between the pectoral fascia and the breast, or the mammary glands of the breast. And this is what we call the retromammary space. This makes the breast to be movable. However, this is very significant. It is used by mainly doctors. Its clinical application is that when the breast becomes fixed, that means it has been invaded maybe by a carcinoma or a cancer, which is making the breast to become fixed and unmovable by affecting this retromammary space or growing into this retromammary space, preventing the breast from moving. Actually, it is also the space that is manipulated by the plastic surgeons when they are trying to increase the size of the breasts. So it is that space that allows the free mobility of the breast over the pectoralis major. We also have the serratus anterior muscle. Now, the serratus anterior muscle and the external abdominal oblique muscle are found deep to the inferolateral 2/3 of the base of the breast. Infero, that is inferior, but laterally. So that inferolaterally, we find there the serratus anterior muscle and also the external abdominal oblique muscle. The skin of the breast shows the following. Of course, we talked about the nipple, just like the other side. And we saw the nipple is found in the fourth intercostal space. We also say that the nipple is pierced by 15 to 20 lactiferous ducts, and it contains saccular and longitudinal smooth muscle fibers, which can make the nipple stiff or flat. Then we have the areola. Areola is a saccular area of a pigmented skin surrounding the base of the nipple. Of course, we talked about this. It is rich in modified sebaceous glands, the ones we call montgomery, and they become enlarged during pregnancy in preparation for lactation. Actually, this explains why the breast becomes larger and larger. The skin of the nipple and areola is devoid of hair and has no fat beneath it. If you look at the internal structure of the breast, we say the breast is made up of the parenchyma or the glandular tissue. It's also made up of the stroma, which is the supporting fibrofatty tissue. Now, the parenchyma, just like we said, is made up of 15 to 20 lobes. 15 to 20 lobes converging towards the nipple. These lobes are divided into lobules, which lobules, these lobules are separated actually from each other by the fibrous septa. Each lobule contains a cluster of alveoli and is drained by lactiferous ducts. Now, the lactiferous ducts converge towards the nipple and open on it. Each duct has a dilation. Actually, as they move towards the nipple, they dilate, forming a lactiferous sinus, which stores milk for some time. Actually, this explains why milk can easily flow out of the nipple, even when the baby is not breastfeeding. Later, we also say the internal structure contains of the stroma, which is the supporting fibrofatty tissue. The stroma forms the main bulk of the gland and is distributed all over the breast, except beneath the areola and the nipple. Of course, we say the nipple is made up of the smooth muscle. The stroma, mainly the fibrous stroma, forms the fibrous septa. So we have talked about the septa, the fibrous septa that separate the different lobules. So these different lobules are separated by septa, which septa are formed by the fatty stroma. By the fibrous stroma. And these fibrous septa are also called the suspensory ligaments of Cooper, which anchor the skin and the gland to the pectoral fascia. Now, these fibrous septa, or what you call the suspensory ligaments of Cooper, attach the breast to the pectoral region, to the muscles beneath. Actually, they span from the overlying skin of the breast to the pectoral fascia, where they hold the breast in its normal position. Actually, these suspensory ligaments of Cooper, they mainly do two functions. And one of them is to separate the secretory lobules of the breast. And second, they attach and secure the breast to the dermis and the underlying pectoral fascia. Now we have the male breast. The male breast differs from the female in the case that the male breast is rudimentary and its glandular tissue consists of ducts with no alveoli. Yeah, our breasts are rudimentary, the males, and the glandular tissue just made up of ducts with no alveoli. Yeah, thank you so much for watching the video. Hope you can answer questions like what is a breast, what is the shape of the breast, what's the use of, give two uses of the suspensory ligaments of Cooper, and anything. I know now we are well conversant with the surface anatomy of the breast. So thank you so much for watching. Don't forget to subscribe.